Welcome to the Silos to Circles Community Guide to starting a local healthy aging initiative. In 2018, 4 rural Minnesota pilots were funded to help older adults, their families, and their neighbors connect better for a healthier aging community.
We have to reimagine what aging and living in our communities is and investing in the changes to make it happen.
The Silos to Circles Age Well approach is founded on collaboration. The pilot communities are organized around a powerful common agenda, building stronger connections and greater community awareness of the people, places, and resources to help community members age well.
There are a lot of resources locally, even though the communities are small. They are service rich. It's just knowing how to tap into them.
The connection's been very beneficial, and again, the people that have tapped into our services tell me great things. It was very helpful. They learned a lot, but the people that haven't yet tapped into it, that's where I was saying this is every bit as important because they know it's there.
This really presented an interesting opportunity for us to go out into our communities and be relevant beyond building a building.
The Silos to Circles approach centers on a few basic principles for action. First is to convene local partners. Each pilot brought local partners together to understand the problem and build a plan that works for each unique place.
Back in 2016, when we hosted all our community convenings, we had a big wall full of sticky notes of all the services that were available to us in the area. And we all sat back after that meeting and were like, wow, we had no idea half of these even existed. And most of the room consisted of high community stakeholders and healthcare providers.
This is just a wonderful resource that we have 41 different agencies and 50 some community members that are part of this committee, and they're so actively engaged.
I think each one of us knew someone. We didn't know certainly the breadth of who sits at our table today, but we knew someone and got them connected, and finding that right person who is energized by this kind of work and bringing them on, and they know somebody too.
The next step is connecting providers and professionals so each aspect of the local support system links seamlessly with the others.
So we have monthly meetings where we do roundtable discussions, and that's a really nice spot to network with those providers. We also do outreach where I drive out to different communities and meet with those providers and just have a conversation, hand out our brochures, and touch base with those folks as well.
Some of the surprises that have come out of the coalition is just talking to members, maybe getting a better relationship. So when we make those referrals, it's more of a personal relationship that we're making that warm referral to.
A final principle of action is to equip the community. This means helping older adults and those who support them to be more aware of the local people, resources, and support systems that can assist them as they age.
We needed sort of a quote-unquote air traffic control person to help guide seniors, their families, friends, neighbors, and even healthcare providers to the right services and what they need.
Well, I think just have a connection point locally, because families, you hear all the time, well, who do I call? Where do I start?
Well, I think with the interaction I have with people, it's great, whether it's on the phone or in person, to really have that conversation and really find out what are their needs.
Where I've seen the biggest impact of this program is on the people who are aging themselves, have aging parents, have aging grandparents, and just know that I have a phone number to call, I have a person to talk to.
Really, Chisago Age Well is about the idea of that it takes a community to care for our elderly.
I think for other communities that might be looking at doing this, what's nice is we have several communities across the state that have been going through a similar process, and we're definitely here to answer questions.
We hope you will use the Silos to Circles Community Guide as a resource to join these communities in the journey toward your own healthy aging initiative.